What is schizophrenia? It is a mental disorder that affects how individuals see, think, or process information around them. It is characterized by impairments in the way reality is perceived and associated changes in behavior. Myths and facts about schizophrenia. Myth 1. Schizophrenia means you have multiple personalities. Facts. The idea that schizophrenia leads to numerous personality is a widespread one. This, however, is untrue. Dissociative identity disorder and schizophrenia are two distinct diseases. Hearing voices during hallucinations is a symptom of schizophrenia, but this is not the same as having split personality. Schizophrenia and split personality are neither etiologically nor diagnostically related. When hallucinations do occur, they are typically auditory, and affective flattening, apathy, and avolition are more common in schizophrenia than gross disorganization of thoughts and behavior. Myth 2. Bad parenting can cause schizophrenia. Facts. There are other elements at work, but poor parenting does not cause schizophrenia. Schizophrenia is a mental illness, and while the precise etiology is unknown, researchers believe that a few variables contribute to the development of this condition. Genetics as well as psychological and environmental influences are all important. Study was conducted by Danish in which children born into schizophrenic households but raised by families without the illness were compared to children born to and raised by parents without schizophrenia. According to the genetic theory of the disorder, schizophrenia and similar disorders were discovered in 32% of the group but only 18% of the second group. According to these adoption studies, parents with schizophrenia pass on the risk of the illness to their children, even if the children are raised by parents who do not have the disorder. These studies demonstrate that biological and genetic factors influence the risk of schizophrenia. They also show that parenting does not lead to schizophrenia. Myth 3. There is no cure and you will never recover. Facts. Schizophrenia can be more difficult to treat than other mental health problems, in part because some people may not know they are experiencing schizophrenia symptoms. That being stated, schizophrenia treatment is available and can assist you. In study, 80% of people who did not get neuroleptics or therapy relapsed 2 years after leaving the hospitals. In comparison, just 48% of those getting treatment had relapsed. Individuals who received both therapy and medicine performed better than those who received only medicine. Therapy alone lowered the relapse rate of individuals who had been rehabilitated to the community for 6 months, but it lost its efficacy after a year, except in patients on active drugs. This study concluded that a combination of pharmaceutical and behavior therapy can provide the greatest effect for at least a year following discharge.